a smoker? Are you over the age of 55? Do you have high blood pressure? Are you overweight? If so, then you are at a high risk for a stroke. Based on my research of strokes, I present information on how strokes occur and how they can be prevented. Strokes are vital. If not handled with care, the victim's result may be death. During the minutes to follow, I present information on how strokes occur, what the signs for strokes are, how they are treated, and finally, how they can be prevented. What are strokes? Strokes is a condition where a blood clot or ruptured artery or blood vessel interrupts blood flow to the brain. A lack of oxygen and glucose or sugar flowing to the brain leads to death of brain cells and brain damage, often resulting in an impairment of speech, movement, and memory. That is according to Medical News Today. According to Monica Rhodes, there are two types of strokes. One is an ischemic stroke. This is a stroke that develops when a blood clot blocks a blood vessel in the brain. The clot may form in the blood vessel or travel somewhere else in the blood system. About 8 out of 10 strokes are ischemic strokes. They are the most common type of stroke in older adults. A hemorrhagic stroke is a stroke that develops when an artery in the brain leaks or bursts. This causes bleeding inside the brain or on the brain surface. Hemorrhagic strokes are less common but more deadly than ischemic strokes. So what are the signs? A possible sign that you're having a stroke is called a TIA, a transient ischemic attack. It is a temporary interruption in blood flow to part of the brain. Symptoms of TIA are similar to symptoms of strokes, but last for a shorter time period and are less effective. They don't last permanent damage. Within a few minutes of having a stroke, brain cells begin to die and symptoms can become present. It is important to recognize symptoms as prompt treatment is crucial to recovery. The common symptoms, however, are dizziness, trouble walking, loss of balance and coordination, numbness, weakness, or paralysis on one side of the body, blurred, blackened, or doubled vision, and a sudden severe headache. For how are strokes treated? For an ischemic stroke, treatment focuses on restoring blood flow to the brain. If less than 3 hours have passed since your symptoms occurred, doctors may use medicine that dissolve blood clots. Research shows that this medicine can improve recovery from a stroke, especially given within 90 minutes of the first symptoms. Other medicines may be given to prevent blood clots and control symptoms. Now, hemorrhagic strokes are hard to treat. Doctors may do surgery or use medicines to stop bleeding or brain swelling. The best way, however, to get over a stroke or to become better is stroke rehab. The goal of stroke rehab is to help you regain skills you lost or to make the most of your remaining abilities. Stroke rehab can also help you make steps to prevent future strokes. You have the greatest chance of recovering from a stroke in less than 3 months of having the stroke. So how can you prevent it? Well, if you've had a stroke in the past, you are at a high risk of having another. But there are some precautions that you can take. Number one, don't smoke. Smoking doubles the chances of you having a stroke. And avoid secondhand smoke if possible. Eat a heart-healthy diet, such as fruits, vegetables, beans, fish, high-fiber grains and breads, olive oil, and lay off the salt. Try to moderate activity at least 2.5 hours a day. These are blocks within 10 minutes. And the doctor will prescribe to you what kind of activity he feels like you are able to do. Stay at a healthy weight. Control your cholesterol and blood pressure. If you have diabetes, then control your blood sugar. Keep it at a normal rate. Limit alcohol. According to Medical News Today, if you're a female, you're only allowed to have 1 beverage per day, and if you're a male, only have 2. Take a daily aspirin or other medications that the doctor prescribes. Avoid getting sick with the flu. In other words, get a flu shot. So as you can see, strokes are very serious and can be deadly. And understanding what a stroke is, what the signs are, how they are treated, and how they can be prevented, a victim of a stroke may indeed survive the stroke. In order to help someone with a stroke, you must consider the points that we discovered. What a stroke is, the signs, how they are treated, and finally, how they can be prevented. So if you know somebody that's having a sign or having a stroke, you can better assist them and maybe save their lives. Thank you.